In this video, I want to talk about hospice and the changeover from normal Medicare to Medicare hospice. This is a complicated decision and one that you need to talk to your doctors and other caregivers about on when do you change over from normal Medicare, assuming that you're on Medicare, to Medicare hospice. There's a lot of insurance implications associated with switching to hospice, so that things that were paid for under Medicare are not going to be paid for under Medicare hospice. And you should find out in detail what your insurance, Medicare versus Medicare hospice coverage, is going to be before you make the change, so that you know what bills you're going to end up paying. When you switch to Medicare hospice, the focus is comfort care. And so many of the doctors that you may have been seeing before, for example, a neurologist, is not going to be paid under Medicare hospice because they don't consider the neurologist to be comfort care any longer. So you need definition of exactly what bills are going to be paid through Medicare hospice versus what you were getting paid, having paid by just Medicare. Hospice nurse visitations at home, hospice, even Medicare does provide some home health nurse visits. The hospice nurse visits we found to be extremely helpful. The hospice nurse people really have an understanding of dealing with a patient with terminal disease, and they tend to be more upfront about what's going on and not be equivocal in terms of what they're telling you. And they have practical advice because they've seen it before, and they're really helpful in terms of to you as a caregiver on ways that you can help the pals get through the symptoms that they're dealing with at that point in time. If your pals ends up and needs to be in a nursing facility, in a hospice nursing facility, you want to look into getting hospice care at night, so that there's somebody to stay with the pals, a hospice person to be able to stay with the pals on an overnight basis. And you want to make sure that you get somebody good, somebody that's going to do a good job of being with the pals on the overnight basis, and you want to make sure that it's properly scheduled. We found a lot of difficulty on getting that scheduled properly, so that a hospice nurse or a hospice caregiver or a hospice aide was available on an overnight basis. So the lesson here is, when you change over from Medicare to Medicare hospice, find out what the differences exactly are going to be, what the new payments, so who's going to get paid under the new thing, and what benefits you're going to get under Medicare hospice versus just Medicare. The problem is, when you need hospice at the end of life situation, it's difficult to change from Medicare to Medicare hospice in a day. And when you need it, you got to have the hospice care before you need it. The question is how much before, and that's something you got to work out with your doctors.